Good morning to you all. I'm Renee Francoeur with Cabinet Communications and the moderator for today's COVID-19 update. We are joined today by Premier Sandy Silver and the Acting Chief Medical Officer of Health, Dr. Catherine Elliott. Closed captioning is provided by National Closed Captioning. Thank you to Mary Teason for providing our ASL interpretation and to Andre Bossier for providing our French translation. Following the remarks from our speakers, we will go to the media present in the room and then on the phone lines for a round of questions. I'll call you by name and you will each have 2 questions. Before we begin, I'd like to verify that everyone can hear us. If any of the reporters are having problems, please email ecoinfo@yukon.ca. I will now hand it over to Premier Silver.
Thank you very much, Renee, and good morning, everybody, and thanks for joining us on the traditional territory of the Kwalin First Nation and the Ta'an Quachin Council. I'm very happy to be here again with Dr. Elliott and Andre and Mary to share more about the situation we're in right now with COVID-19 in the territory. Our vaccine rollout continues. This week, the clinic in Whitehorse had focused on providing kids age 5 to 11 with their first shots. As of Monday, more than 600 children have already received their first shot. I know that it's a big relief for parents and is likely an early Christmas gift for families. The goal is to ensure that all children can receive their first dose before Christmas. This is our priority for a safer holidays, and so I'm very grateful to all the staff who have logged those long hours in the clinic to help support our goal. So thank you to everybody who's working over there. We truly appreciate your dedication. Booster shots for those age 18 and older has also begun here in the Yukon, and many appointments have been booked for the coming weeks. There has also, it's also great to see that as well. More appointments will be coming available in the coming days and weeks. We're asking people to be patient there. All eligible Yukoners who want a booster shot should be able to receive one before the end of January. You are eligible for your booster if it has been 6 months since your second shot. The vaccines, again, are proven. They're safe and effective. They remain our best protection, and I continue to urge all eligible Yukoners to get vaccinated, to get a booster as well once you're eligible. Of course, you can find a clinic information and also book your shots online at yukon.ca/This is our shot. You can also call the COVID-19 info line for information on clinic dates and times, and that number is 1-877-374-0425. Walk-ins will be accommodated when possible, but remember, they're not necessarily guaranteed. It has now been 2 weeks since the vaccine requirements for employment has come into effect. Overall, it has been great to see how many people have attested to having their first dose of their COVID-19 vaccination. As attestations continue to come in, I have some updated numbers to share with you today. As of yesterday, December the 14th, 94 attested, 1.5% are full-time employees, and that is 90 people. Last week, Minister McPhee reported 100 individuals, so we have seen an increase of an additional 17 individuals who have attested to their vaccine status. The majority of those who have not yet attested are casual or on-call employees, accounting for 3.2% of the workforce. Those who have not yet attested can return to their jobs once they receive their first shot and attest to their vaccination status. If your employment has been impacted by a vaccine requirement, and if you are having trouble booking your vaccine online, you can call the number that I said earlier, which again is 1-877-374-0425. tell the agent who answers that your employment is impacted and that you were unable to book the vaccine online, and they will take your phone number and your name, and the vaccine team will do everything in their power to find an appointment for you as soon as possible. Thank you to everyone who has made their attestation, and thank you to those who are looking to do so now. And regardless of your vaccination status, I want to thank all of our public servants for their service. The Government of Yukon provides a range of services to Yukoners throughout the territory, and it wouldn't be possible without the many dedicated individuals that show up each and every day to serve their fellow Yukoners. So thank you very much for that. December is obviously in full swing. I hope everyone is enjoying the brisk air, the fresh snow, lots of sundogs out lately, that's for sure, and hopefully many other joys that winter does bring as we rush around and gather gifts and festive eats. I want to take a moment to remind everybody again of how important it is to shop local. This is especially true as we celebrate another season in the middle of a pandemic. There's so many gem locations right across the territory. In fact, Minister Pillay with Economic Development has been very busy on social media highlighting some incredible businesses that have the perfect offerings for the season. So check out his Facebook or Instagram for those fun videos as he tours around and finds the perfect stocking stuffer. I know that local businesses have been challenged again and again by COVID-19. We appreciate the dedication of Yukon businesses to adapt and to innovate as well, to continue to provide goods and services to Yukoners. So thank you. Thank you for adjusting and keeping everyone safe and healthy. It really matters. And as the Premier, I just want to know that we're extremely grateful for all of those efforts. We are here for your business. In the initial phase of the pandemic, our government took early action to provide the financial support necessary for businesses and employees. We were one of the first governments in Canada to launch programs to support individual and businesses impacted by COVID-19, including paid sick leave programs and other business relief programs as well. And throughout the pandemic, we have continued to adapt as we navigate through the pandemic. Since we declared the state of emergency last month, we launched 2 new funding programs to support local organizations and businesses impacted by the most recent public health measures. The Yukon Emergency Relief Program, for example, that's a relief program focused in on funding, eligible for fixed costs for businesses and non-recoverable financial commitments for events that were canceled or significantly altered because of the new orders under the Civil Emergency Measure Act. The program has one stream for businesses, and it also has another stream for non-government organizations, NGOs. Additionally, the vaccine verification rebate is here to help those businesses and organizations that are required to check for proof of vaccination before allowing people to enter into their premises. That vaccine verification rebate will provide up to 50% rebate, up to a maximum rebate of $500 to help offset the cost of buying a QR scanner or a mobile device where necessary. Yukon businesses and organizations can contact the Department of Economic Development to start an application for either program. And the email address for them is ecdev, and that's at yukon.ca, so ecdev@yukon.ca, or also by phoning 867-456-3803. Again, it's extremely important to support local all times, but definitely during the season here. It's also important to take precautions as you gather with friends and family. Our case count has stabilized, which is great news, but we still have active cases in the territory. We continue to work closely with communities to respond to cases. A rapid response team is being mobilized and will head up to Old Crow this week to help up there. We have also been hearing a lot more information about the new variant, Omicron, which remains a concern. We know this variant spreads very quickly, and we need to take it very seriously. It was the majority of the conversation with a First Minister's call yesterday with the Premiers and the Prime Minister. We need to be very careful during the holiday season to limit spread as much as possible, and of course we're continuing to have every effort to do so as we head into the holiday season. So be safe, be kind, and with that I will hand it off to Dr. Elliott. Thank you very much. Ganashtish.
Thank you, Premier Silver. Good morning, everyone. Bonjour. I'll begin today with a case count overview. As the Premier's pointed out, we continue to see steady case counts. There have been a total of 1,606 people infected with COVID and 1,550 people recovered since the beginning of the pandemic. 14 Yukoners have died from COVID-19 during this time. As of this morning, we have 52 active cases in Yukon. Of those, none are Omicron. The dominant variant we encounter continues to be Delta. The 7-day average of active cases is 67.6, compared with 63.6 the week before. Over the past week, the average number of new cases a day is 8. The percentage of our gold standard COVID-19 tests that are coming back positive is almost 12%. Let's pause for a moment and consider these numbers. These numbers show us that we're at a stable level of COVID-19 infection. We continue to be in the middle of the Delta wave, and we're able to manage the case counts we have every day in terms of our response. We've all worked hard to get here, and we're managing. Now is really the time to keep this up, because what we do now really matters. We need to wear our masks, to take the time to wash our hands, to keep our group sizes small, stay physically distanced, and socially connected, to limit our travel to communities. It is so important to stay home if you feel sick, even a little sick, even if you are vaccinated, even if you really think you need to go to work today. Most importantly, please get all the vaccinations for which you are eligible. Our continued efforts show how resilient we are here in Yukon, and it's not been easy. At times, it's put pressure on our family, on your job, maybe on your relationship with friends. This may have made you miss social, cultural, and sporting events. Many have made the decision to change their travel plans once again. And those who may not have wanted to initially, may not have wanted to at all, have gotten vaccinated to protect us all. The hardship that you've endured and that we've all endured together as a community has been worth it. It has drastically slowed the spread of COVID-19 in Yukon. It has kept people out of hospital, it has saved lives, and it's protected all those people who are working so hard to respond to COVID-19. The staff at YCDC, the nurses who are giving vaccinations, the healthcare workers and nurses, those throughout government and businesses who are rapidly reacting and responding to all the changes in programs that we've had throughout this pandemic. Together, we've kept each other safe, and we've kept our community together. As the Acting Chief Medical Officer of Health of this wonderful, wonderful place called Yukon, I want to say one thing. Shonitan, Gunalchish, Masicho, merci, thank you. Our efforts have stabilized the situation and shown us that we can manage the Delta variant by using our layers of protection and responding with circuit breaker when we need to. We're not out of the woods. We continue to see COVID-19 activity throughout the territory. We are managing an outbreak at the Whitehorse Correctional Centre, where we've been able to contain the situation. We continue to have exposure announcements at schools in several communities, and schools are working hard to keep students safe. We have a cluster in Old Crow, and as the Premier said, are sending a rapid response team to assist. We're in a good position here in Yukon, thanks to your hard work, and there's still a high level of risk. All this said, COVID-19 has thrown us a new challenge called Omicron. In time, here in Yukon, Omicron will become the dominant variant. What we do now is about how much we can slow the time when Omicron is spreading in our community, and how much we can abate or protect ourselves against any severe disease that Omicron could cause. We've worked so hard to get to this point, and Omicron is pushing us to work harder. Let's think, one way to think of it is to think of the forest fire risk signs that we see along our highway here. So currently, if we had such a risk sign, we would be in the orange. The layers of protection with Delta have worked to slow the spread and stabilize the situation, and also to limit the number of people who have had to be hospitalized or who have passed away. The new thing with Omicron is that it's so transmissible that in places where spread did not occur with Delta, when Omicron arrives, it will occur. If we think about the layers of protection as turning what could be dry firewood into wet wood here in Yukon and limiting that spread, what Omicron does is it turns up the intensity and the heat so that that wet wood will burn. Whereas with Delta, one person who's infectious in a restaurant might infect a few people at their table. With Omicron, they could infect the entire table and people at the next table or in other parts of the restaurant. In a gathering, rather than infecting a few people who spend a lot of time talking to a person who's infectious, with Omicron, it'll infect many more of those in the room. This is why we have to be so careful now, so that a single person cannot infect a large number of people. Where just a small spark can ignite a blaze, and that blaze can spread quickly. We're seeing this in many parts of Canada. It's only a matter of time before Omicron comes here to Yukon. So you can see that with Omicron, a single gathering, whether a party or gathering at work, where we've seen spread in social events and in work staff rooms and other places like this. When Omicron is here, it will infect a lot more people, who will then infect others who they are close to. So when we think about this, what we want to do is turn down the heat to limit the spread and to protect ourselves from severe outcomes through vaccination. One thing I've seen time and again throughout this pandemic is people think they're going to get infected by somebody who's foreign or from away or from a different community or a different social group. The fact is we're most likely to infect those people we're close to, those people in our house, the people we see every day at work, the people we're most familiar with. And that's really important to remember. Think about the common cold. It spreads in a very similar way. Who would you infect with a cold? Probably your family. If you had a cold, you might infect your family or your workmates, your team, your arts group. These are the close contacts. These are the people we've chosen to be close to because it's so very important to have those social and physical contact. And yet, these are also the people where we need to have caution and use our judgment to be cautious as much as we can. all the time staying socially connected. So we really know what to do, and we could manage this. We could manage Delta by using our COVID sense, and we will be able to manage Omicron by using our COVID sense. And so I'm asking you to use your COVID sense during the holiday season. Carefully plan your activities outside your home. Have your masks and your hand sanitizer ready. Please stay home if you are sick. Even with a little sniffle, a bit of a chill in the morning, or a cough, please stay home. Let's be honest though, holidays are traditionally a time to gather with family and friends. So when you do attend a social or public event, just be extra vigilant. Gatherings, events, and celebrations are lowest risk when they're with people who you're already in close contact with, people from your household. If you choose to gather with people from outside your household, choose lower risk activities and settings. Get outside. Keep voices low. So, things like singing, you want to keep a bigger distance with that type of thing. Wear your masks. Meet with people who are fully vaccinated. And use those layers, use that COVID sense, multiple public health measures to reduce the risk. Regardless of your vaccination status, use all the public health measures. And please stay home when you're sick. These measures are most effective when layered or combined together. And this is why we have the measures in place right now. When you're thinking about what could be the risk of a certain situation, I'd like you to consider the following. How many people you're gathering with are vaccinated? And are there people who are vulnerable? For example, people who aren't vaccinated, people who are older, people with chronic disease. If you're going to a setting, avoid it if it's crowded or if it's closed, or if the ventilation isn't good. Follow the traffic flow, follow the business plans. Wash your hands as you enter the store, the local store, to buy your local Christmas gifts, which we have so many incredible local businesses. Wash your hands on your way in, wear your mask, keep your distance. You might want to ask the host ahead of time about which public health measures will be in place. You might want to get a sense of what proportion of people might be vaccinated. These are questions that are really legitimate to ask right now. And people are going to have to make some difficult decisions about celebrations. And these decisions are personal, and we need to show kindness and respect people's different decisions. Of course, at this time, Yukoners love to travel. And it may well be that you have a trip planned, whether locally or within Canada or internationally, or to one of the communities, or from a community into a city to shop or meet with friends. If it is, please use your COVID sense and travel wisely this holiday season. Many of us are looking forward to seeing friends and family members that we've not seen for so long, which is wonderful, and we can do it with caution. None of us want to make others sick. None of us want to bring Omicron back to Yukon. So here's some ways we can do this. If you're planning to travel internationally, or perhaps you are already overseas or somewhere or in the US, please follow the federal travel advisories. These are changing rapidly, so check the Government of Canada travel website. I would advise that you be prepared to be tested and or to isolate when you return to Canada. Check with the Public Health Authority at your final destination for more information on travel restrictions and other public health restrictions and recommendations at that location. Please be cautious wherever you're planning to travel and look to see what the COVID activity is in that place. There may be additional provincial, territorial, and local public health measures at your final destination. Consider how to use these precautions and how to use the protections you know. If you are vulnerable to severe COVID, whether it's because you're not fully vaccinated, because you're older, because you have chronic disease, consider staying at home and keeping your contacts to a minimum. Or think about who can you be in physical contact with a limited number of people, and who can you stay in contact with without being physically close. There are many rumors about travel right now, so checking official websites is very important. For the latest updates on the Government of Canada travel advisories, please visit travel.gc.ca/traveling with 2 L's /advisories. So I think it's clear that Omicron is a real present threat, and we're certain that it's more transmissible than any other variant. And it's already becoming dominant in many parts of the world, and even in some parts of Canada. It's spreading faster and wider than any strain of COVID-19 before. Its health impacts and severity are not known. Vaccines do not appear to work as well against the Omicron variant, based on what we know now. And I can't stress enough how cautious we all need to be in the face of the new strain. I'm as eager as anyone else to be done with COVID-19, honestly. And I also am eager to have this current state of emergency come to an end and to lift public health measures. We have to do what we have to do right now, and it really, how well we do here in Yukon in terms of how many people get severe illness or pass away really has to do with how we conduct ourselves in the holiday season. And that's why I keep saying this over and over again, because it's just so important and it really does make a difference. Of course, one of the key, in fact, the most important measure we have at this time is the vaccinations. And it's really essential we continue to get everybody in Yukon vaccinated for their first shots, second shots, booster shots, etc. So let's have a look at where our numbers are today. 91% of Yukoners age 18 and older have now had their first shot, and 88% have had their second. 28% have received a booster shot. For youth, 12 to 17, 84% have had their first shot and 78% have had their second. For children, age 5 to 11, already 18% have received their first shots. You can expect that number to increase quickly as we roll out a focus right now on pediatric vaccines. The Whitehorse Clinic is fully booked, and we have teams visiting the communities, and we're going to vaccinate as many children as we can before the end of 2021. We're giving out a lot of stickers to kids with sore arms these days, and some of them are not too happy to get vaccinated, but many of them are very happy. Let me tell you, I know many children who were upset that their parents didn't get them the first vaccine appointment that was available in Yukon. When I went to book appointments, they were full. And my own child was upset that he wasn't going to be the first. Next month, we'll have more availability for booster shots, and we'll remain committed to making one available for every Yukoner who's eligible by the end of January. The vaccination team is working so very hard, and remember that this is the team that worked so very hard last Christmas season to get everybody as vaccinated as possible. Please, when you see them, thank them and treat them with respect and kindness. They've done such an incredible job. So overall, our vaccination numbers are good, but we're still seeing some gaps, and we want to continue up the efforts to get as many people vaccinated as possible. If you haven't had your first or second shot, please do so soon. And Dr. Silver spoke to how you can reach out if this is affecting your employment at this time. Did I say doctor? Wow. Premier Silver has just said that. I want to talk briefly about alternative vaccines. There are some people who are interested in the Johnson & Johnson or Janssen vaccine. And if you're in that situation and you have that rare situation where there's a medical need for this vaccine due to health concerns that have been identified and recognized by your medical professional, you can call this number and explain your situation, and someone will call you back to assist you. So the number to call if you're in that circumstance is 1-877-374-0425. I'm speaking a lot today. It's because we've had a lot of questions and a lot of interest. And here's the next one that people are really interested in, testing. So rapid antigen testings have been in the news a lot lately. And we've used these tests here in Yukon when they're appropriate. So for example, we've used them when we need to screen a large population very quickly. We've used them when we need to assess situations where we don't have access to the molecular testing. And this is how we've been using these rapid testings. Antigen testings are not as sensitive as molecular tests. In fact, I'm going to preempt this by saying there's different kinds of rapid tests. So there's your antigen tests, which is what most people mean when they talk about rapid tests. There's also a molecular rapid test, or what we have here in Territory is the ID Now. These are different types of tests with different characteristics. So I'll talk here about antigen tests. These have a role to play in certain circumstances, and we've used them in the public health interests of Yukoners, and they've served us well where they're needed. The molecular tests, the rapid test takes a little bit longer and requires more skilled human resources, and the gold standard test takes even longer to get results and requires a laboratory. Most of our gold standard tests are sent to BC, and we get the results in 2 to 3 days. We're also able to offer results online, which makes everyone get their results quicker. The other thing to know about the lab-based test is we get better information. We find out what variant that test is, that sample is, and this is really important right now as we track Omicron and we look at introduction here in Territory. I know there's a lot of public interest in rapid tests, and they have a certain role to play in certain circumstances, and we're continually reviewing and looking at the appropriateness of this for general use. And we're continually looking at how can we get results back to people faster so the interruption to their life from getting tested is limited. So for the time being, we have a strong system, and it's because of, for many reasons, one of which is the Omicron variant. It's really important to get these molecular tests. If you have a rapid test result that's positive, please get a confirmatory test, both to be sure that it's a true positive, and also so that we can see what variant we have. Remember that there's in Whitehorse 2 facilities for COVID-19 testing. The drive-through testing is available at 91,628 Alaska Highway in the Centennial Motors Wash Bay across from the airport. It's open every day from 8:30 to 5:30 p.m. and appointments are not required. Walk-in testing is available at the CTAC. It's best to book an appointment by calling 867-393-3083. And the testing center in Whitehorse is open every day from 8:30 to 6 p.m. Outside of Whitehorse, testing is available at local health centers, and please call them to arrange your testing. So in closing, I want to reiterate my thank you for all that you've done during this pandemic. It has been a long haul. And I want to also ask you to tighten your seatbelt for the challenges that lie ahead. We have a new variant on the horizon, and it's spreading rapidly throughout Canada and around the world. Our special holiday seasons will light up the coming weeks, and I'm asking you to use your COVID sense and creativity to practice safely as you visit family, friends, and do your shopping and enjoy the beauty here at home in Yukon or wherever you are this holiday season. Take the break you need. Do what you need to do to stay healthy for your mental health and your physical health. Enjoy healthy food, get out for a walk, and visit with people safely. And most of all, don't lose faith. We'll get through this. Take a deep breath. Enjoy what you can, whether it's a fire at home, whether it's the sundog, the sparkling snow, whether it's a visit or a talk with someone you haven't been in touch with for a while, whether it's seeing a friend across the theater or across the street and having a wave and a smile. Perfect that over the mask eye smile for all the strangers you meet. Use your common sense to thank people. Everybody's working hard at this time of year. Many people are tired, and when people are short, recognize that it's a tough time and they need our support. Please get all the vaccines that you are eligible for. Travel wisely, make your decisions wisely. And we've all done so well so far. What we need to do now is to continue our effort together to keep our community healthy and strong. Shoni Tan, Gunal Chish, Masi Cho, thank you. Merci.
Thank you, Dr. Elliott, and thank you, Premier Silver. We'll now move on to the question and answer session with media. A reminder to reporters, please identify which speaker you would like to answer your question before you start, and please also remember to mute and unmute yourselves. We'll first go to the reporter in the room and start with Luke at CKRW.
Thank you. This is a question probably best for Dr. Elliott. I know there's a rapid response team that you said that's heading to the Old Crow. I was wondering if you could update us on the Old Crow situation a little bit. I know there was a presumptive 5 positive cases in addition to 3 confirmed. Do you have an updated case count in Old Crow and what the situation is like there now?
So the case count yesterday, I apologize, I haven't been in touch with the team on the case count this morning. The case count yesterday was 4 active cases and 2 recovered. What I did get updated on this morning was around the spread, because that's always what we're looking at. As of this morning, the majority of cases were looked like they were introduced from outside the community or close household contacts. We're watching to see if there is spread in the community. Old Crow community has really taken this bull by the horns and used all the tools in their toolbox, including supporting people at home with food and necessities, giving advice. Our medical health officer will be on the radio answering questions and talking about the situation. And we're really grateful for that partnership, and we'll continue to work with them. And at this time, we're not seeing transmission in the community or community transmission. We're seeing really local situations. Thanks.
And a question for Premier Silver. At the First Minister's meeting yesterday, was there a lot of discussion about travel? I know there's a lot of questions that people have about it. So was there a lot of discussion about travel, and could that be maybe a day-to-day changing situation right now?
Yeah, I wouldn't be surprised if we didn't hear something very soon from the federal government as far as some international measures. You know, right across Canada, panning across, you know, the Prime Minister again reiterated at that call the obligation and responsibility internally, domestically, is within the provinces and territories. And then to get a quick update as we went coast to coast to coast was very telling as well. We see what's going on in Ontario, and we see what's going on in Quebec. And again, the rapid increase of Omicron is very interesting. Premier Ford talking about, you know, Omicron is or will be, you know, the dominant strand very soon, and just amazed at how quickly it's going through the system. You know, talking with Dr. Elliott as well, you know, the statistical analysis of the data from Africa, it's just too soon to tell really, you know, the long-term effects or the strain on a local system here. You know, you go to BC, Premier Horgan doesn't have a lot of active cases right now of Omicron, so it seems to be, you know, trending more in eastern Canada than it is in the west. But again, this is, you know, the precautionary tale that we've been learning every time there's an outbreak, is to watch these other jurisdictions and prepare for them. In BC, they're really focused in on, you know, this travel is hard internally anyway with all of the devastation through climate change to the road systems in general. But his comment last night was, you know, we're not foreseeing currently any changes to any travel restrictions at this time, but it was very telling to have a full conversation right across the nation of how folks are dealing with Omicron. And as we you know, as we prepare here locally for the inevitability of strains coming up to the Yukon, I'm really grateful for how well we've learned through each one of the outbreaks. Forging Forward spoke about how we need to up tools very quickly. Moving forward as a pandemic turns to endemic or turns to other variants, and I think that we've proven the ability to do that very, very quickly. Even though we do have a very tired group of dedicated Yukoners working in the front lines.
Thank you.
Thanks.
Thank you. We'll now move to the phone lines and start with Haley at Yukon News.
Thank you. I do have a couple questions about the use of rapid tests in the territory. Obviously, it's a discussion that's taking place in a lot of different jurisdictions, but I'm wondering, Dr. Elliott, if you could talk about why aren't tests being provided to the general public? We're seeing that in some other provinces and territories, and I'm wondering what the current strategy here is in the Yukon with just providing rapid tests to the general public.
Thanks for the question. So when we talk about rapid tests, mostly what people are talking about is rapid antigen tests. This is important because in territory we also use, as is used in many jurisdictions across Canada, rapid molecular tests, or the ID now. So I'm going to be talking about rapid antigen tests, which are the test kits that are being handed out in various parts of Canada at this time and are also being used here in Yukon. With some in certain circumstances. Rapid antigen tests give a quick result. They're fairly easy to use. They're not as easy as chewing a piece of gum, but they're fairly easy to use. And the result is pretty good. If you get a positive, it's probably a positive, and if you get a negative, it's probably a negative, but it's not 100%. They have a role to play, especially when you have a lot of disease or you have to test a lot of people quickly and you can't use the best tests. People using tests at home is definitely the way of the future, and we will get there. It has both benefits and risks. So the benefits are that people who are testing themselves, they want to do the right thing. They can test themselves and use their COVID sense based on the results. The downside is that it's really important that we understand the full gamut of how infection occurs. And this is actually something I've been wanting to say, so I'll take this opportunity. A person gets infected on a certain day with COVID-19. With the Delta variant, a few days later, they become infectious, maybe 1, maybe 3. And a few more days later, they get symptoms. So there's a few days in there where they don't know they have anything, and they are possibly spreading that infection. And that's why we say wear masks, keep your distance, etc., because there is that period. Once they have symptoms, they may get better in a few days. And during that period where they have symptoms, that person is infectious. This is the key. After a person gets better, they can still be infectious for up to 10 days from when they started those symptoms for most people. For people who are get more severe disease, et cetera, it can be a longer period. So if you get symptoms and say you test positive, you stay home for a few days, you feel better, go back to work. Well, you've gone back to work infectious. And I think that's also part of what we're seeing is that what's been seen across the country is sometimes people they test positive, they make their decisions. They're not always the decisions we would advise. But even more concerning is those people trying to do the best thing who don't realize they're infectious and go back about their activities and expose other people. So this is why we offer, public health counseling and advice, why we offer supports and that type of thing. The other thing, as I mentioned, that's really important is that we track the variant right now, and the only way to do that is through a lab-based test. So we are looking at the role of rapid testing and the best place for it in our system here in Yukon. We are using it currently, and we're looking at the best ways to continue to use it or broaden that use over the coming weeks and months. So more to come on this, but it is really important to know it's not completely straightforward. and it's still important to get a lab-based confirmatory test for those people who are using the rapid test right now. Thanks.
Thank you. And your second question, Haley.
Yeah, thank you. So I understand that the federal government has provided, both those antigen rapid tests and a number of the Abbott ID Now molecular tests. I'm wondering if you could talk about, you said they've been used in a number of different circumstances. If some of those federal allotment have been provided to private businesses, I've heard, for example, that they might be being used, with mining companies. Could you talk about that? Are these tests from the federal government being provided to private companies in the territory?
So we have, when we look at the territory from the beginning of the pandemic, one of the things we do in public health is we try to we target our focus on those areas where we're most concerned about spread. So that includes places where a lot of people live together in a congregate living setting, including our large mine settings. We have provided rapid antigen tests and rapid molecular tests to mine settings, and our mines have fantastic medical oversight and laboratory capacity to run these tests, these rapid tests. And we use them both when we have cases on mines and also for people coming in or exiting the mine to do some screening, depending on the specific scenario and risk scenario. We've also used rapid molecular tests in a number of other settings throughout the territory. So we've positioned technology and provided training in places like certain medical settings, the hospitals, some of the drug and alcohol treatment residential settings. We've used them at the Whitehorse Emergency Shelter. And just there's a huge list of settings, honestly, that we've used these rapid molecular tests, which are much more accurate tests than the rapid antigen tests. We're continuing to broaden our use of these, and as we and the rest of the country learn more about the appropriate use of these technologies, we will continue to do so. Thank you.
Thank you. We'll now move to Amy with CBC.
Hi, thank you. This question is for Dr. Elliott. I was wondering if there's been any severe cases of COVID-19 in Old Crow so far.
So far, I'm not aware of any severe cases of COVID-19 in Old Crow during this current situation. Thanks.
Thank you. Amy, do you have a second question?
Yes, my second question, what is the rapid response team going to be doing for Old Crow residents? Will that include rapid testing?
So our rapid response team will be providing testing support in Old Crow. This may include using rapid molecular testing in a health center or community setting. And often also includes social supports depending on the community's needs. The community has expressed that, as we've seen time and again in waves of COVID, that not only does COVID affect individuals, but it affects individuals who work in response. And so when there's areas of response that need support, these are the areas where the rapid response team will assist. Thanks.
Thank you. We'll now move to Dirk with the Canadian Press.
Hi, I'd like to ask the Premier, you said there's no Omicron cases in Yukon yet. I'm wondering, do you feel it's inevitable that Omicron will arrive in the Yukon?
I'll channel my inner CMOH. It's not our first rodeo when it comes to outbreaks. And what I've heard every single time that there's epidemiology that's challenging in the rest of Canada, sitting in these updates, we need to be prepared for the inevitable. So again, no different with Omicron versus Delta versus Gamma. We will be prepared for the inevitability. The team at the Chief Medical Office of Health have done an impeccable job of tracing and understanding how Omicron has been internationally moving, and also, updating me on the evidence and also statistically relevant information as we prepare for these things. But yeah, I mean, there's no magic formula to stopping in its tracks the spread of a variant, especially when our supply chain management is so connected to transportation to the lower provinces. And part of the conversation having with the premiers and the prime minister about international measures when we know that Omicron is already in Canada. Again, anything we can do to reduce the spread is really the focus right now.
Thank you. Dirk, do you have a second question?
Sure. I'd like to ask Dr. Elliott. You outlined how well Yukon has done to knock back the cases of the Delta variant. I'm wondering if you could go over again how, even though it hasn't arrived, how you plan to fight Omicron.
Sure. So with Delta right now, we're in the middle of a wave and things are stable, and that's why we continue to have measures in place. And we ask people to still be cautious and use their COVID sense. Really, what we will see with Omicron is looking into a crystal ball. It's clear that this variant is more transmissible and is able to outcompete Delta very rapidly. What this means is that spread will occur more rapidly than it has with previous variants, and there'll be less room for error. As in other situations with variants, we will learn from what's going on across the country, and I myself have met with the chief medical officers of health across the country probably 6 or 7 times now since the first detection of Omicron in Canada. And we continue to learn, and we have rapid updates from these experiences. We have the tools in our toolbox. I think if you look at the Forging Ahead document and the pillars, these are the ways that we control a variant, whether it's Omicron or, we'll see Zeta one day. We're always going to get new variants. The tools are immunization, testing, and case and contact tracing capacity. They are our public health measures and the ability to surge, increase or decrease those measures according to the risk activity. There are capacity to respond through acute care, to respond to sick people. They include really good partnerships with communities and First Nations as a testament. Old Crow, our work in Old Crow right now is a testament to that. Our work with the government, with Chief Tisha Tram, and throughout the Old Crow to provide the supports they need in order to respond and offer our expertise in infectious disease. I think what's different about Omicron so far is it's touched us sooner than previous variants. It was only recognized a variant of concern in late November, and we've already had cases here. We've been able to contain those cases, but it's already here. It's spreading so quickly and becoming dominant so quickly. And so I think it's a matter of we know what to do, vaccinate, test and trace, use our public health measures, make sure our acute care system is ready, have a capacity to surge, and each and every one of us to do the right thing and have that COVID sense in order to keep ourselves as safe and healthy as possible. Listen, with a highly transmissible variant, even if there's a 1% hospitalization rate, you can still have a significant impact on the healthcare system. And so not transmitting is really, really important. Thanks a lot.
Thank you. We'll now move to Tim at the Whitehorse Star.
Yes, good morning. My first question is for the Premier. I had a phone call from someone yesterday who was posing an interesting question. He wanted to know, as far as the vaccine mandates go, why it didn't cover school bus drivers. Can you confirm that's the case?
I'll have to take a look into it again. What we what we have said is, contractors working with government officials and are included in the mandate. I don't have an answer or response for you right now on that. I'll look into it.
Do you have a second question, Tim?
Yes, and this is probably more for Dr. Elliott. Once we start getting more Omicron cases, are those going to be sort of separated out in the case counts and reports so we know how many Omicron cases there are and how fast it looks like it's spreading?
Thanks for the question. Yeah, certainly we'll continue to look at Omicron in terms of the fraction of our cases, so what percentage. I really do want people to know that it takes a little bit of time to get a variant information. And so using caution now is important because certainly across the country, we know that the spread occurs before you're really aware of the variant being present. If we have, we'll use the same benchmarks that we always use. So a case, how contained is it? And then how much, are we seeing transmission outside of the home in the community? And then are we seeing widespread community transmission? These are the types of benchmarks that we'll use. We'll certainly provide, what we know about the fraction of the variant so that people can understand, whether or not it's becoming dominant. I think what we've seen in the rest of Canada and around the world is that it becomes dominant quickly, and so that's, if I had a crystal ball, that's what I would be expecting once we have transmission of Omicron. Thanks.
Thank you. We'll now move to John with CBC. Hello, John at CBC. We'll circle back. Anna at CBC.
Hi, so my first question is to Dr. Elliott. Last week you mentioned that there were 2 Omicron cases in the territory. Can you clarify whether these people have recovered? Thank you.
Our 2 Omicron cases have recovered. Thanks.
Do you have a second question, Anna?
Dr. Elliott. So if Omicron is such a variant of concern, as you say in this press conference, then why not tell people to cancel their gatherings over the holidays? Thank you.
So in terms of gathering advice we have now, we already have advice that people should gather in 2 households for social gatherings. We have advice for organized gatherings. We've limited many places to 50% occupancy. We have mandatory masking, vaccine passports, vaccine mandates. And these are the measures that we have in place at this time. People are urged to take caution, particularly those people who are at higher risk of severe disease. So that's people who are not fully vaccinated, those who are older, and those with chronic conditions. We also advise people to use their own COVID sense and do the things that they need to do to help themselves feel safe. This might include avoiding crowded indoor spaces, having gatherings outside rather than inside, and modifying who's at the event, looking at the vaccination status, as well as acknowledging, admitting, and knowing that transmission can occur from vaccinated people to other vaccinated people. Thank you.
Thank you. We'll now move to Vincent at Radio-Canada.
Oui, bonjour. Une question en français pour Dr. Elliott. Vous dites que on sait que le variant est très transmissible, mais peut-être un peu moins violent. Est-ce que vous pouvez nous répéter en français pourquoi c'est une menace sérieuse pour notre système de santé? Merci.
So, Dr. Elliott, you said that Omicron is a variant that is highly transmissible. Can you repeat in French why you're concerned about this variant and what people can do about it?
OK, merci pour la question. Le variant Omicron est plus transmissible et il y en a des questions qu'on a encore. L'évidence est vraiment tôt et tout ça peut changer avec les changements de l'évidence scientifique, mais on connaît des choses maintenant. On connaît bien que c'est bien transmissible. On sait que on voit les cas qui sont pas aussi sévères, mais on voit aussi des gens qui arrivent à l'hôpital, etc. Et on sait vraiment pas tellement si c'est plus ou moins virulent que le variant Delta. L'évidence qui est toujours tôt et qui évolue encore. On sait que on pense qu'à ce moment-là que les vaccinations sont pas aussi fort contre Omicron et que on pense que c'est toujours protégeant contre les maladies sévères, mais pas aussi protégeant pour les maladies, pour la transmission. Alors, on peut voir les impacts sur le système médical, bien la santé publique et bien les soins à l'hôpital. Parce que si on a beaucoup de cas, même si c'est pas sévère, on a beaucoup de cas sévères et aussi, même si on a des cas et c'est plus sévère, on verra des impacts à l'hôpital. Maintenant, ce qu'on regarde, c'est ce qui se passe autre part au monde et au Canada et voir comment ça impacte les systèmes médicaux, les santé publiques et ça va nous apprendre ce qu'on peut expecter ici quand ça devient le variant dominant ici. Merci.
Thank you. Une autre question, Vincent?
Non, je vous remercie.
Thank you. We'll now circle back one more time to John at CBC. And did I miss any other reporters on the line? Thank you. That now concludes our COVID-19 update. Our next COVID-19 update will be next week. Thank you again to our speakers and everyone who joined us on the line and live over Facebook. Stay safe and stay kind, everyone.